And welcome back. So pleased now to have Alice Bonner in our studio. Alice is with Johns Hopkins. How are you doing?
I'm doing well, thank you.
You just finished a panel. Give me an overview of what was talked about.
Sure. So we were talking about the shift in particularly older people and people with complex conditions being cared for not in the hospital but actually in the home care setting. And so the panel was myself, Scott Code from Leading Age, who's an expert in technology and home technology, and Dr. Russell Portnoy, who is a palliative care and pain specialist. And the moderator kind of walked us through what kinds of technologies are now being used in the home to promote what we call aging in place, so older people can stay in their homes and not have to move to a nursing home. And Dr. Portnoy talked about palliative care and how it's important that older people's goals are understood and that we ask people what they really want when they develop a serious illness or have chronic conditions. And I talked about a program we have at Johns Hopkins University School of Nursing called CAPABLE, which stands for Community Aging in Place, Advancing Better Living for Elders. And it's about a nurse and a occupational therapist and a handy worker who go in over 4 months and help an older adult to be able to stay in their home through home modification and really improving their confidence in themselves.
So does data support people staying at home? Do they do better at home?
So first of all, most people want to stay at home, and 90% or so say they'd rather be there than be in a nursing home. The data with CAPABLE is very compelling in terms of the program enabling people to be able to be at home and have better rating of their pain, so their pain is less depression. Depression goes down by about 50%, and falls and things like that. We track actually activities of daily living more than things like falls, but mobility and people's ability to get around their home and how they rate their own function is dramatically improved. And then the costs go way down. So, 1 or 2 hospitalizations over a year costs our system, all of us, taxpayers and so forth, a lot of money. And if people are able to be in their home and be treated at home instead of going to the hospital, the program pays for itself.
Was there anything that you learned from being on that panel this morning that you didn't know before?
So I think that I work in this space, so I think a lot of it was familiar, but I think some of what Scott talked about in terms of what Leading Age does around technology, trying to provide information for the public and for health systems, what's available in remote patient monitoring, what's available through telehealth, and how do you evaluate whether or not a program that, lots of technologists will come to people and say, I have a great solution. Well, that wasn't my problem, right? Come and tell me and ask me about what problems I'm trying to solve, and then together let's figure out what the solutions are. So I think Scott did a nice job talking about how Leading Age is approaching some of those technologies. And I think all of us together really were able to talk through the importance of healthcare and communities coming together. We talked about community-based organizations and how healthcare providers need to be familiar with what an area agency on aging, for example, can offer, or a council on aging, because older people go back to the community even if they've been in the hospital. We need to connect them with those community resources. So we talked a lot about that.
Very good. Alice, very interesting discussion. Thank you so much for your time, Alice.
Well, thank you. Thanks for being here.
And Alice Bonner is with Johns Hopkins. Stay tuned. We have much more to come. Interview.